Hi, my name is Cassie Thatcher, and the pathology I'm going to be demonstrating today is a colonic volvulus. Projections we're going to do is a AP supine abdomen, which will show the anatomy, and then we're also going to do an AP upright abdomen, which will show any free air in the abdomen that might have been caused by the perforation. Once I obtain the order for the x-rays, I need to check it, make sure it's accurate, and then I'm going to get the patient and go through their name and date of birth to make sure I have the correct patients. The next thing I need to do is get the patient ready for the exam, which is going to include having them change into a gown so that I don't have any artifacts on the images. The next thing is make sure they're not pregnant, so we're going to ask about pregnancy and their last menstrual period. And then I'm going to go ahead and get the signs and symptoms. So we're going to be asking questions such as if they're having any abdominal pain, nausea, vomiting, diarrhea, constipation, if they've had any surgeries. So once you've covered all of that and have your patient in the gown, you're going to go ahead and have your patient get on the table. They're going to be laying on their back. You're going to need a 14 by 17 cassette, and it's going to be lengthwise. You're going to need to go ahead and line up your tube with the bucky. This projection is done at 40 inches. You're also going to want to go ahead and put your marker. I'm using my right marker on the outside so that it is out of the way of the abdomen. The next thing you want to do is go ahead and feel for their ASIS, and go ahead and feel around to the top of their crest, and that's where you want to center along with their mid-sagittal plane. So just going to move her a little bit here. And to check for the mid-sagittal plane, you can always feel along the ribs to the xiphoid tip to know that you're in line. You also want to make sure that you're getting down low enough, so you're going to palpate for the symphysis pubis. You're just going to do one quick check with your finger. We've got it covered, so we should be good there. The next thing I want to do is make sure I shield the patient. Now, because this is a female, we're not going to be able to cover the gonads because that's going to be in the exposed area. However, we can go ahead and place a shield below the light, just like that, more for psychological purposes, so they feel like they're being protected. And I'm going to make sure that she's not rotated any, so you can check for the ASISs and make sure they're equidistant to the top of the table, and make sure that she's straight on the table here so that her mid-sagittal plane is going straight down the table. The next thing we're going to want to do is measure the part. So I'm going to grab the calipers. We want to measure the path that the central ray takes in and out of her body. So if you could raise your hand up for me. Slide that under. And she measures 21 centimeters. So the next thing you're going to do is go out and set your exposure factors. You're going to want to use all 3 chambers for the AEC. And this exposure is taken on suspended expiration. Okay, for the next projection, we're going to do an AP upright abdomen. So you're going to want to change your tube around to use the upright bucky. You are again going to want a 14 by 17 lengthwise cassette. You're going to want to go ahead and line your bucky and tube up for a 40-inch SID, and make sure it's in detent and everything's aligned before you bring your patient over. I'm going to have you come on over. Now, I did go ahead and put a shield on her, however, be very careful. Again, it's merely for psychological purposes, but you want to make sure you keep it out of that light. Okay, so let's go ahead and have you scoot over a little bit. We're going to center again using her mid-sagittal plane. You want to make sure that your cassette is pretty close to right around the armpit area. You're not as concerned this time with the symphysis pubis, so don't worry about how low you are. You're merely looking for both hemidiaphragms because you want to be able to see that free air underneath them. So you're going to go ahead again, feel for that iliac crest, and then go about 2 inches above, so that's right about there. And then make sure, again, ASISs are equidistant to the bucky, and you can feel for mid-sagittal. She looks good there. You're going to want to put a marker. I'm going to use the left this time. Put it on her left side and make sure you've got it in the light but out of the area of interest. That looks pretty good. This is out of the way. All right. So you're going to want to again do this exposure on suspended expiration. I'm going to need to measure her real quick. And again, she measures 21. So I'm going to go ahead, go out, set the exposures, and you're going to use all 3 ADC chambers.